My name is Namatovu Imelda. I am a nursing officer. This is my 5th year in nursing practice. My experience has been, I would say, good and bad. The good part is that seeing a person leaving hospital walking when they came in practically dead is the biggest joy every nurse would get. The negative side is losing a patient. It is very hard for me to break news to a family. When the pandemic hit, I was in Ginger. So the first lockdown, I was about 8 months pregnant. I had worked at that job for 2 months when they shut down all our contracts. So when COVID came, they fired all of us and I had to come back to Kampala. I came back to Kampala in March 2020 and in April is when I delivered, in the middle of the lockdown. So during that time before delivery, I watched all presidential addresses, praying to God that the president will say all pregnant women can actually board a car or a boda to go to the hospital freely, and I never had that. People were being beaten, mothers were being beaten. A lot of mothers were dying at home because they could not access facilities. So I was also scared that I would go through the same fate. I would always ask myself, how am I even going to reach the hospital? My labor started around 3 a.m. in the night and I didn't tell anyone because I knew there were no means of transport to the hospital. When it became morning, we had to go to the local council to get a letter that allows us to use public transport. So I reached the hospital and delivered a very healthy baby and then came back home. 6 weeks after that is when I got a job. So I left my baby home when he was 1.5 months to start working. I would express breast milk and keep it in a fridge to have a continuous supply during the day, and then I would go to work and come back in the evening. When I received the news that I was actually positive for COVID-19, I was scared. I was scared of going back home because at home we were about 9 people staying there. So I went to Mulago COVID unit, Mulago National Referral Hospital. When I reached there, I was advised that I could not be admitted there because I was not critically ill and I had a 4-month-old baby. So they advised me to get medication and go back home to be in social isolation. The home that I went to, it was basically impossible to be in social isolation, considering we were sharing rooms with my cousins, my aunties. The only thing I could do is to have a mask on all the time to protect both the family and my baby. The N95 mask itself is not an easy mask. You feel like in there you're actually not breathing. But what I would do is I would put the mask on at all times whenever I am with people or when I'm breastfeeding my child. The only time I would hold my baby is when I was breastfeeding. Whenever I wasn't breastfeeding, he would be away. I would watch him from a distance. Our health system needs a lot of preparedness. During that time, we were very unprepared because I think we were so used to outbreaks of cholera, Ebola, yes, and this was something very, very new. It required a lot of research within a very short time, and I feel like we need empowerment in research, and also health workers need to be mentally helped, because we are always trained to help others, but it hits us hard when we have to take care of our own health.